Do you know that sleep apnea is deadly? Hi, I'm Kelly, a pharmacist from Kaisa Pharmacy. Okay, so if you are a Star Wars fan, you would know who this is. This is Princess Leia or Carrie Fisher, who died in the late of December 2016 after completing Star Wars Episode 8 The Last Jedi. Okay, her death was ruled as due to sleep apnea and sleep apnea related complications. So if you know of anyone who suffers from sleep apnea, yourself, your spouse, or even your family members, you may want to share the following information with them.
Sleep apnea is a potentially severe sleep disorder that occurs when a person stops breathing while sleeping, sometimes for just a few seconds and sometimes for minutes. Symptoms include loud snoring, stop breathing during sleep, gasping for air during sleep, awakening with a dry mouth, morning headache, mood swings and irritability, insomnia, and hypersomnia, which is excessive daytime sleepiness. Sleep apnea patients don't always pass away from sleep apnea itself, that is, from a lack of oxygen while sleeping. Instead, the complications triggered by untreated sleep apnea can eventually result in death. Studies published in numerous sleep journals have shown that untreated sleep breathing disorders like sleep apnea carry a high mortality risk no matter the patient's age, sex, and BMI. Another study, which studied 385 men with mild to severe sleep apnea over an 8-year period, found that male patients with severe sleep apnea had a much higher mortality rate than those with mild to moderate apnea. Participants with severe sleep apnea were also 33% more likely to die during the study due to their condition compared to those with mild to moderate apnea. Common treatments include breathing devices, medication, and surgery. However, some lifestyle changes and home care can also improve your quality of life and your sleep. Doctors commonly recommend people with sleep apnea to lose weight. Obesity, specifically in the upper body, can increase the risk of airway obstruction and narrow nasal passages. These obstructions can cause you to stop breathing suddenly or for lengths of time while sleeping. Maintaining a healthy weight can keep your airways clear and reduce sleep apnea symptoms. Studies also show that modest weight reduction in people with obesity can eliminate the need for upper airway surgery or long-term CPAP therapy. Regular exercise can increase your energy level, strengthen your heart, and improve sleep apnea. Sleep apnea is associated with decreased oxygen saturation in your blood. As exercise can specifically improve your respiratory strength and encourage oxygen flow, thus it improves sleep apnea symptoms in the long run. Altering your sleep position can also reduce sleep apnea symptoms by some degree and improve a night's rest. Studies show that more than half of obstructive sleep apnea cases are dependent on position. Sleeping on your back or the supine position can worsen symptoms. For some adults, sleeping on the side can help breathing return to normal. Discuss body positioning and your sleep apnea symptoms with your doctor to evaluate your options for treatment. Humidifiers are devices that add moisture to the air. Dry air can irritate the body and the respiratory system. Using a humidifier can open your airways, decrease congestion, and encourage clearer breathing. For added benefits, consider adding lavender, peppermint, or eucalyptus oil to the humidifier. These 3 essential oils have known anti-inflammatory and soothing benefits. However, be careful to ensure cleanliness of your humidifier. Dirty humidifiers can harbor molds and bacteria. Avoid smoking and alcohol. Tobacco use may contribute to inflammation and swelling in your airways, and this can worsen your snoring and sleep apnea. Alcohol, on the other hand, relaxes the throat muscles that control your breathing, which can then worsen snoring and cause your sleep cycle to be interrupted. Alcohol can also inflame the airways, thus blocking the airflow. Therefore, consider to quit smoking and limit your alcohol intake as this lifestyle modification is beneficial to reduce sleep apnea complications. As sleep apnea happens when the upper airway muscles relax while sleeping, it causes the person to not get enough air. Sleep apnea machines like breathing and oral appliances are incorporated to treat sleep apnea and other sleep-related breathing disorders. The two most common therapies used to treat sleep apnea are CPAP, or continuous positive airway pressure, and oral appliances like masks or mandibular advancement splints. CPAP, or continuous positive airway pressure, is a machine that uses pressurized air to keep the breathing airways open and prevent the airway from collapsing while you sleep. With CPAP, you wear a mask over your nose or mouth while you sleep. The mask is hooked up to a machine that delivers a constant flow of air into your nose. An oral appliance is a small mouthguard-like device that repositions the lower jaw in a way that prevents airway obstruction. A mandibular advancement splint, or mandibular advancement device, connects to both the upper and lower teeth in order to protrude or move the jaw forward. The device helps open the upper airway by moving the base of the tongue forward. The oral appliance is designed to be inserted before sleep, then removed in the morning. Talk to your doctor or healthcare provider if you or someone you know suffer from sleep apnea.